Cardiac dysrhythmias. So myocardial cells are heart muscle cells. They're responsible for the mechanical response to electrical impulses. They're able to generate electrical impulses. The heart has different pacemakers. So the pacemaker cells are specialized cells which can initiate an electrical impulse. A good characteristic of pacemaker cells is their automaticity. Automaticity is basically their ability to generate electrical impulses, regular rate, and rhythm. So if you look at the right side of your screen, this is how the conduction system looks like. So we have the SA or sinoatrial node, which is our normal pacemaker, and this is our AV node. This is atrioventricular bundle, also called bundle of His, and then we also have the left and right bundle branch, and then we have the Purkinje fibers. Sinoatrial node or SA node is the pacemaker of the heart. It's located on top area of the right atrium, the conduction to left atrium, and the AV node. We also have the AV node or atrioventricular node, also known as junction nodal, located between the lower atria and upper ventricle, and the conduction is to the bundle of His. The bundle of His is basically an AV node to top area of ventricular septum, and it splits to form the bundle branches. And the bundle branches, we have the left and right bundle branches. So right and left bundle branches run down through the ventricular septum, and they're located in the ventricles, and then the branches bifurcate even further. Lastly, we have the Purkinje fibers, which innervate the ventricular walls. Influences on electrical conduction. So there are many factors that can affect the heart or the conduction system of the heart or the electrical activity of the heart. Myocardial irritability, it's usually affected by hypoxemia, electrolyte imbalances, especially K or potassium and mag. So whenever you're at the hospital and your patients all of a sudden it's starting to experience abnormalities in their rhythm, one of the first things you may want to check is their K and mag. Also, another thing that can affect myocardial irritability is acid-base disturbances. So if it's too acidic or too basic, those can cause some dysrhythmias. In addition, the nervous system can also affect it. So both the sympathetic and parasympathetic system can cause some changes or can cause some abnormalities or irritability of the electrical conduction of the heart. Catecholamines such as epinephrine and norepinephrine can also affect the electrical conduction of the heart. In addition, there's also electrical stimulus such as being hit by lightning, electrical outlets, and power tools. And definitely, if somebody had cardiac surgery or open heart surgery, the manipulation of the conduction system, so that can cause some changes in the conduction system of your heart. A lot of times, this can result the result of dysrhythmias. It can be lethal. Sometimes there are dysrhythmias that are non-lethal. Dysrhythmias can also cause some change in heart rate, blood pressure. It can cause some chest pain, and some patients will also complain of shortness of breath. So general treatments for dysrhythmias include oxygen supplementation or oxygen, and it is also very important to correct the cause. So if it's electrolyte imbalance, acid-base imbalance, and something else that we can fix. Sometimes it is also necessary to do electrical conversion via cardioversion or defibrillation. And in addition to the general treatment, we also have medications or pharmacological treatment with the use of antidysrhythmic agents. The mechanism of actions of antidysrhythmics, they vary, but they do affect various sites of action potential in the cardiac cycle. The therapeutic effect, mostly, it decreases the irregular heartbeat or rhythm. So sometimes, depending on what we're talking about, it can cause some change in the rate. So how fast it can usually slow down, and how regular it is, and which pacemaker it's coming from. Indications for antidysrhythmics are irregular heart rhythm. And sometimes not necessarily irregular, but sometimes irregularities in heart rhythm. Either it can be a super fast or high rate. So some precautions with antidysrhythmic agent, they're also known as having pro-arrhythmia effect, which means it induces irregular heart rhythm. As mentioned earlier, although they're used to treat irregular heart rhythms, they can also cause irregular heart rhythms or dysrhythmia. dysrhythmias, and also caution with renal function or dysfunction. So some contraindications include certain heart rate and blood pressure parameters, because antidysrhythmics can cause some decreased heart rate and increased heart rate sometimes, and also it can cause some changes in the blood pressure. So it's very important to follow certain parameters that's set by the provider or the policies and protocols depending on what dysrhythmia we're talking about and what drug we are talking about. Also, depending on the serum drug levels, and those are going to be something that we need to take in considerations, and certain things that either they're high or low. Certain antidysrhythmic medications are contraindicated. Some common side effects of antidysrhythmics include dysrhythmia. So again, we're talking about the pro-arrhythmia effect of antidysrhythmic medications, changes in vital signs, including heart rate, blood pressure. Sometimes it can cause some confusion, and some medications, such as amiodarone, can cause pulmonary fibrosis. So nursing actions or interventions when it comes to administering or with patients who are on antidysrhythmics. One very important thing is assessing cardiac rhythm, also oxygen supplementation, and also assessment of oxygenation status, drug levels, electrolytes, and acid-base balance. It is also very important to do patient education regarding the drug effect, side effects, symptoms associated with dysrhythmias, and some lab work. Next, we're going to be talking about examples of drugs used to treat dysrhythmias, and when it comes to that, we also want to make sure that we know where are they classified, or what are they classified as pertaining the Vaughan-Williams classification of antidysrhythmic drugs. So we have the class 1, 2, 3, and 4. First, let's talk about class 1. So class 1, they're the fast sodium channel blockers. Class 1 or fast sodium channel blockers, they inhibit sodium influx through the cell membranes, thus slowing down the rate and amplitude of initial rapid depolarization, reducing cell excitability, and then reduces conduction velocity. So among class 1, we have A, B, and C. A, quinidex or quinidine, procan or pronestil or prokinamide. Under B, we have dilantin or phenytoin, and xylocaine or lidocaine. And C, tambocor or frekinide, and rithmol or propafenone. Under class 2, we have beta blockers. So we have the Brevibloc or esmolol, Inderal or propranolol, and Lopressor or metoprolol. Class 3 or potassium channel blockers, they're mainly used for ventricular dysrhythmias, but they're also used for atrial dysrhythmias. We have Betapase or sotalol, and the very known and commonly used Cordarone or amiodarone. So this is one medication that you're gonna see a lot, and I do expect you to know this medication or get familiarized with it. So how does this medication work? Again, because it's a potassium channel blocker, it inhibits the potassium efflux or flowing out through cell membranes. It's most commonly used to treat dysrhythmias that are difficult to treat, and increases the action potential duration, changing the electrical potential impulse. So the role of potassium channels in cardiac action potential is cell repolarization, recovers and restores its electrical charges to normal, blocking channel or delay the repolarization. So it increases action potential and increases the refractory period. This is a medication that's also commonly used in addition to our ventricular dysrhythmias. Cordarone or amiodarone is used for atrial fibrillation or atrial dysrhythmias. Class 4 are the calcium channel blockers. One example is Kalan or verapamil, and we also have cardizem or diltiazem. Another common drug that's used for certain heart rhythms or dysrhythmias is adenocard or adenosine. The class of adenosine is under nucleoside, and it's used to treat increased heart rate, and mainly it's used to treat SVT or supraventricular tachycardia. The action of this medication is to basically decrease the heart rate. Now, this medication's half-life, so this right here means half-life, it's actually 10 seconds. So it's so fast. So with giving adenosine, you have to push it fast. Anyhow, next would be atropine. The class of atropine is anticholinergic, and opposite of adenosine, atropine is to treat decreased heart rate or bradycardia. So the action of that is actually it increases increases the heart rate. And another medication is lanoxin or digoxin, which we previously talked about. It is a cardiac glycoside, and you need to know about this medication. Although it's no longer a primary medication that we use to treat CHF, it's still used for cardiac dysrhythmias. So general nursing actions or interventions when it comes to administration or patients on antidysrhythmic agents. One, of course, if we're treating the dysrhythmia, we want to make sure we're assessing for cardiac rhythm, especially before and after administering a medication. We also want to follow or monitor and assess heart rates and blood pressure because the medications have an influence to that. We also want to assess the response to the medication. Are we achieving our therapeutic effect? Is the patient experiencing any side effects? Also, we want to follow the lab, CBC, electrolytes, renal function, the serum drug levels when applicable, and definitely patient education such as the drug effect, the side effects, the symptoms associated with dysrhythmias, lab works, follow-up appointments, when to call for help, and depending on what medication, any signs and symptoms of toxicity. And definitely it is very important to educate them about their safety when they're on this medication, such as ensuring that they're checking their heart rate to make sure that it's okay to give that medication.